All right, so really quick, I just want to talk about something. Drains. Now, you guys are always super paranoid about the drains because you have no idea what they are. So, what is a drain? Basically, a drain is not for fluid, first of all. Not for lymph fluid, not for swelling, does not help with that. You can have drains in and still be blown up like a pumpkin. Drains are not for swelling. What comes out of your drain is blood. So here's how it works. You either have like a little bulb or you've got like that like pack thing, which is just super deep. People in DR love to do that. Miami too. It's like a big, like accordion looking thing that you gotta like, that's a mess. I have seen it where doctors won't even put a bulb on the end. They'll just leave this tube hanging out of you. So that tube that you see is not the drain. The drain is a flat piece of plastic. Now in all my other videos I talk about this, but I don't really go into detail. So the drain is a flat piece of plastic. So it's basically like, think of like a PVC pipe, and it's flat and it's white and it's got like perforated holes in it. What that's for is for blood. So you're getting cut up inside. They do it with lipo if you're getting a lot of lipo done. If you're going to have internal bleeding after lipo because you're all cut up, they'll do it for lipo. Some doctors get a little paranoid and go overboard and put a drain in anyway, which then hinders your healing instead of helping it, which we talk about in the other videos. So go and watch those. But it's meant to get the blood out of you so the blood doesn't sit in there and get black and cause an infection. So you get cut up all on the inside. Let's start with something simple as lipo. You get cut up all on the inside. Now you have basically like a bleeding hole in your body. The drain is in there if it's lipo, and if it's that bad, the drain goes from your hip. Usually you'll have them here, right? And it'll go around your hip and snake around back this way. If you've had your drain in for a long time, you'll feel it. Like you can be able to palpate and feel like a ridge, or sometimes you'll even be able to see it. So it can go in both sides all the way around, or it's just one side. You see the little hole here. There's an anchor stitch, a black stitch that holds the drain so it doesn't slide out. And then you've got that plastic piece with like the bulb on the end. So that's what it is. It's meant for blood. What comes out of that drain? How much should you be draining? What does that look like? So usually they take it out when it's 25 cc's or less in a day. After surgery, you're going to be draining the whole thing like twice a day and dumping it out. Anywhere from 5 to 7 days is when it should be taken out if you're healing properly. If you have a faja that doesn't fit right, if you're using a board when you're not supposed to, if you're using a waist trainer, if you're doing crazy stuff, if they give you a binder and it's cutting into you, that thing will be draining constantly because you're putting pressure on a wound. You're putting pressure on a scab. If you have a scab and it's trying to heal and you keep taking your fingernail and digging into the middle of it and then creating friction, yeah, it's going to bleed. Well, guess what? What's coming out of that drain? Blood. Sometimes a little bit of tissue that you'll see in there. It's not a blood clot. Relax, guys. Take a breath. If you had a blood clot, you'd be in the hospital. I get why you guys are upset about these things because no one explains it to you, which is why I'm here. Hi. So a little bit of tissue will come out of there. Blood will also come out of there. When you're towards the end of like getting your drain out, or when there's no more blood coming out, it's a clear like orangey fluid, and then it'll become like a yellowy fluid. That yellowy fluid is lymph fluid. That needs to stay in your body. If that is happening, your drain's ready to come out. So it's meant to just get the excess blood out of you. Again, anywhere from 5 to 7, sometimes 14 days if you caught an infection or something, or if you, like I said, have something that's cutting into you continuously, it will continue to bleed. Doctors will take it out when it's 25 cc's a day. That's all you're draining. Usually, sometimes they'll take it out maybe if it's more, maybe if it's up to them, you know, that's a whole nother thing. Well, what happens in Miami and DR when you don't have a doctor to do that? What happens when they kick you out of the plane and they're like, hey guys, bye, good luck, figure it out. You cannot go to the emergency room to get those things taken out unless they have a plastic surgeon on hand. You cannot go to an urgent care. You should not be doing that yourself. And no one in the state of New Jersey, unless they are a surgeon, nurse, or physician, will take that thing out for you. Do not come into my office and ask me to take that out. I will tell you no, the same way I'm telling you no now. That is not safe. That is a medical device inside of your body from surgery. So, Mia Aesthetics, 305 plastic surgery, New Life plastic surgery, For You Beauty Aesthetics. They will tell you, oh, just snip the stitch and pull it out yourself. I have had people pass out. I have had people have to be taken to the ER afterwards because what's happening is if it's in for that long and you're that swollen around it, your body starts to create tissue around the drain. It starts to swell and it starts to think, oh, this is in us. We need to heal around this. Kind of like the way a tree trunk will eat a sign. If there's a sign stuck to a tree trunk, I know you guys have seen this before, the tree trunk starts to like eat the sign because it's healing around it. Your body's kind of doing the same thing with the drain if it's past 14 days. That's 2 weeks. So You want to really get those out beforehand if it's doctor safe, whatever. If you have no direction from your doctor, yeah, 14 days is kind of the max, or depending on if you're not draining into it anymore. That is something we can tell you when we come in. If I see it and I'm like, yeah, it might be time to take this out, professional opinion, you don't really need it for what it's there for anymore, then that's a different story. But no one is taking that out. You should not be doing that at home. That is extremely dangerous. And again, go find a surgeon. You can go to the emergency room and say, I need a, whatever plastic surgeon's on hand, or give me the name of a plastic surgeon to take this out for me, set up an appointment and have them take it out. All they're going to do is cut the stitch and pull it out. Sometimes if it's been in there for a while, it's a little painful because it's literally ripping stuff out on the way because stuff has started to heal around it. A lot of times it just slides out. That's it, because it's still fresh and it comes right out and there's no pain and there's nothing like that. But you should never do that at home. Never, 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 never. I understand that 305, Mia, all those places in Miami will tell you to. There are videos of people doing it on YouTube. Guys, that is not safe at all. The drain is meant to get all that blood out. Now, what happens when you are, because we are safe to do lymph drainage 48 hours after with your drains. It helps your body with the drain. Why? Because your body is absorbing all that extra swelling and it's not putting pressure, forcing blood into the drain, forcing fluid into the drain. It stimulates your body to naturally get that fluid back into the body and use it the way it's supposed to be used. Now, here's another thing that happens. You get even more swollen, like 3 times as swollen with the drain, because your body needs that vital fluid to heal. And if it's not healing, you get fibrosis, you get hard, you get thick. That area around the opening gets really, really scarred, and really it starts to get like thick and hard and hurt. So these are all things that we can avoid by coming in for lymph drainage before. So lymph drainage 48 hours after is safe enough with the drains. If you don't know what I'm talking about, go watch all the videos. It's safe enough to do with the drains. We do not touch the drain itself. We do not work over the drain itself. We work over the skin. So that flat part that's in your body, that will work over to get the swelling out of the way so the drain can work properly. But we're not going near the opening of the drain. We're not touching your drain. We're not messing with it. We're not doing anything like that ever at all. Ever. That is a huge no-no. And if anybody ever tries to touch your drain, you run for the hills, because that is not in their scope of practice unless they are a doctor, a nurse, physician, somebody that's licensed to do that whole medical thing. So we can and should start lymph drainage with the drains. That is the biggest question I get, and you guys are super paranoid. It is so much easier to deal with your drain when there is no swelling around it. There is so much, there's swelling around the drain because your garment's putting pressure on it because your garment doesn't fit right, but there's also swelling around the drain because everything's trying to get into it. So if we can kind of clear up that pathway a little bit, all the stuff that needs to go into that drain, the blood, all the excess stuff from your body can go into that. That's how that works. Now, again, some doctors won't give you a drain. That's okay. You don't need a drain. A drain is not something where it's like, oh, I need to drain for swelling. No, that is not how that works at all. No, go watch the rest of my videos. No. So that's not what that's for. It's for the blood and it's doing its job, but we can help it do its job better. Now, again, sometimes they just leave holes and you're leaking or draining. Yeah, that's not draining or leaking. That's not how that works. Again, lymph fluid is meant to be used in the body and absorbed in the body. You may leak a little bit of blood. You may leak a little bit of fluid because you have an open hole. Now, here's the other thing. What happens when your drain doesn't stop draining, right? What happens when it consistently, or it tapers down and then all of a sudden one day you're back to filling it up again? Why does that happen? Because you literally have an open hole in your body, and as your body starts to heal, it's trying to close that hole, but it can't. So all the good material that your body's trying to use to heal that whole thing keeps slipping out through the drain constantly because it's an open hole that things just keep falling into. And every time you move or twist or do something that's going to cause fluid and blood and tissue to kind of move, it goes out into the drain, and then you wind up having like 2 or 3 days where you're draining under 25 and you're like, yes, I'm going to get it out. And then the day you go to your doctor, you're draining 75, and that was just in the morning, and that's like almost a full drain because it's an open wound in your body. It's an open hole that things are just constantly being pushed into. So it can be a catch-22, but this is why I say find a doctor, because they'll be able to kind of help you with this. Again, we can also look at it when we come in, but that's why that happens with drains. So when your doctor doesn't give you drains and just leaves open incisions, your body is doing the same thing. It's an open hole, and every time your body swells or gets fluid in that area, the fluid falls out of the hole, and that's why you're draining. Leaking after is not a normal thing. If your holes are open, yes, they may leak a little, but if you're in a garment that's too tight or not a garment at all, yeah, you're going to be like it's going to be coming out a lot because you have no support. So the garment helps to keep your body in check so that it doesn't blow up, so you don't have all that excess fluid, so you don't leak out like that. So if you have a garment that's too tight, it's going to force all the fluid out of that hole. If you don't have a garment at all, you're just constantly going to be leaking all the time. And it may take like 4 or 5 days for your body to start patching up that hole because it's just an open wound with pressure from all the swelling, and it's constantly forcing everything out. So you really shouldn't have like leaking or draining like crazy where it's like all over you and you have to, I've seen people come in with wee pads on them. Pro tip, guys, real quick, maxi pads. Go to CVS, get yourself some maxi pads. Even at the incision where the drain is, if that starts to leak, get a maxi pad and cut it just to the size of where your drain or your hole is. Because if you use gauze, that gauze is going to stay wet against you. And if you're using a Band-Aid, it's going to get soaked through. If you're using regular like bandages, again, it's going to be a mess. Maxi pads are wonderful for that. Wonderful, wonderful, wonderful. Even if you just have incisions that are still like weeping a little bit, maxi pads are great. Just make sure that you're cutting it to size. You don't have just giant things sitting there because then it's going to slide and cause friction and going to be a problem. So that's a really good thing for the leaking and the drains and all of that. Again, as far as getting it out, you have one little anchor stitch that's holding the end of that drain. They'll cut that and they'll pull it out. Now again, is it a good idea to maybe take some Tylenol? Yes. 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 The painkillers, mind you, will also affect your drain because you are dehydrating your body and you're kind of in this like, I've talked about this, go watch the video on it, but this like fog state where you don't, like, you know there's pain and you feel it, but you like are too drugged up to care. You're going to be moving and doing things that are not good for the drain. You're going to be, you know, doing motions with your body that may cause more internal bleeding, or fluids that move and all kinds of stuff like that. And then it's going to cause your drain to be more. The other thing, if you are not up and moving, if you are not ambulatory, your body is going to continue building up that blood and pooling it, and then your drain's going to have to take care of it. So get up and moving. Now, I know they say don't do a lot. Yes, don't do a lot, but you should be walking. You should be getting up and going to the bathroom every hour. You should be drinking a lot of water. Water also affects your drains because if you're drinking a lot of water and you're peeing a lot and you're moving, and your body is being triggered to absorb that fluid so that you can pee it out, it's not going out of the drain because it's going into your body and out through your urine. So water, maxi pads, don't pull it out yourself. God, please don't do that. Find a surgeon if you need to and talk to your doctor about it, guys. If before surgery, if you think you're going to have a drain or if you're scared about it or nervous, ask them what it is. Ask them to show you what it is. Ask them when you can get it out. Ask them how to take care of it. Ask them what you should be doing, you know, when it happens. Ask them what it's going to look like when it's inside you. Ask them what to expect. You have to be knowledgeable about these things beforehand because then afterwards, you guys freak out about it because you have no idea what it is. So MLD is definitely something that helps get your drains out quicker, guys. It literally cuts your drain time in half, and it cuts the amount of fluid coming out into your drain in half because, again, there's not all that pressure on the drain. It stops it from hurting. It stops it from throbbing. It stops it from constantly having to, you know, be expelled through the drain. So MLD is totally safe to do. As soon as you can get up and get to our office, as soon as you can get up and drive, that's when you are coming in to our office and getting the actual work done on the drain. If you are not able to get up and go to the bathroom, if you are not able to put on clothes and get out of the house, we shouldn't be doing any work on you, period. That goes for all surgeries, whether you have a drain or not. That goes for all, you know, conditions, whether you're post-surgery or not. As long as you can get here, then it is safe to do lymph drainage. So if you have a drain and you're ready to get here, come on in and we can start working on you. The other thing and the last thing I'm going to say, garments and drains. Doctors will put you in a binder, that wrap thing. That is not a garment. That is a binder. Every time you lay down or sit, you will cut into that drain and force more blood and fluid into the area. That is not okay. Your binder should not be super tight. You want your binder on you enough that it's gentle compression, but you shouldn't be ripping the binder on your body because it's going to cut into your drain and cause a lot of issues. So again, binders, meh. Can you wear a garment with a drain? Absolutely. You absolutely can. You have to get fitted properly by a postop specialist. Hi. You have to get a proper garment that is made for surgery, for drains. high, and you have to make sure that it's comfortable and it's not squeezing the crap out of you, and also that it's not super, super loose. We absolutely can work with drains, and the garment makes it more comfortable with the drains because the little things aren't flailing out all around you, and I teach you guys where to pin them so that they're out of the way and how to take care of your drains and how to deal with all of that. I can do all that in a virtual consult. We can also get you a garment in a virtual consult if you are not in New Jersey. If you have any questions about any of this, virtual consults. I've been doing a lot of those for these specific questions, for teaching you how to do all this. We can get you a garment online, set up another virtual consult, teach you how to use your foams, take care of your drains, make sure that you're comfortable, check your results. We can do everything that we do in a post-op, including find you a specialist in your area, in your town, to do lymph drainage with. I will vet them for you once you pick them and make sure that you are good to go. So again, guys, drains are not a bad thing. Drains are not scary. Drains are not evil. They're not the end of the world. They may freak you out a little bit because it's a tube sticking out of your body, but it's a totally normal thing. Tummy tucks use drains. Drains that are for lipo, if it's really, really intense, those also use drains. Sometimes depending on the contouring work you're getting for a BBL, or if you're getting lipo done on your back, like a lot on your back, they'll put a drain in. Drains are safe. Drains are fine. Drains are okay. MLD should be done with drains. Should be. Not can be, but should be, because it helps the process a million times and makes it so much easier on you guys. So guys, I really hope this was helpful. I'm going to do a couple more of these little ones today, and then they'll post to the IGTV story next week and the following week. If you have questions, email us at hello.amarehealingarts@gmail.com. DMs, we don't really get back to a lot now because we're super swamped, but you can try, and we'll pretty much just tell you to call our office. The best way to reach us for any questions, setting a consult, anything, call our office, 732-841-0142. I will talk to you guys soon. I hope this was helpful, and have a great day. Bye, guys.